high blood pressure. It's often called the silent killer because you can't feel it, but it affects millions of people. So, how do doctors actually treat it? Today, we're going to dive into the strategy and the science behind taming hypertension, all based on the latest clinical guidelines. Imagine this. You go to the doctor, and they tell you your blood pressure is high. That diagnosis can feel, well, a little overwhelming. It's totally natural to wonder, okay, now what? What's the game plan? And that's exactly what we're going to unpack today, step by step. So first things first, let's talk about the goal of treatment. It is so easy to get fixated on those numbers on the blood pressure cuff, right? But the real objective here, the reason we do all this, it goes so much deeper than just hitting a target number. Yeah, this is what it's really all about. The real reason we treat high blood pressure is to lower your long-term risk of some major life-changing stuff. We are talking about preventing strokes, preventing heart failure, and preventing heart attacks. Those numbers on the machine, they're just a tool, a guide to help us reach that much, much more important goal. All right, so how do doctors even begin to tackle hypertension with medication? It all starts with picking what's called a first-line drug. You can think of these like the starting lineup for a sports team. They're the most trusted, most proven players you put on the field first. And first line isn't just some random term your doctor picked. It means these drugs have a mountain of solid scientific evidence behind them. They've been proven again and again to be effective, to be safe, and most importantly, they are fantastic at achieving that primary goal we just talked about, preventing those serious cardiovascular problems down the road. So who are these star players? Well, they fall into four main groups. You've got your thiazide diuretics, which basically help your body get rid of extra salt and water. Then there are ACE inhibitors and ARBs, which work to relax your blood vessels. And finally, you have calcium channel blockers, or CCBs, which also relax blood vessels just in a slightly different way. These four classes are the real workhorses of blood pressure management. How does a doctor pick just one to start with? It is definitely not a guess. Big medical guidelines give a really clear starting point. Generally, for patients under 55 who are not Black, an ACE inhibitor or an ARB is the way to go. For patients who are older or who are Black, a calcium channel blocker or a diuretic is typically the first choice. And this is mainly because different groups of people tend to have different underlying reasons for their high blood pressure. But a lot of the time, that first drug is really just the beginning of the story. The next crucial step often involves what we call combination therapy, essentially building a team of drugs. And get this number. Roughly 2/3, that's about 67%, of people with hypertension are going to need 2 or more different drugs to get their blood pressure under control. And that's not a sign that the first drug failed, it's just the reality of how complex this condition can be. Which, brings up a really good question. If one drug isn't quite cutting it, why not just crank up the dose of that one medication? Why add a whole second drug into the mix? Well, the answer is pretty clear when you compare the two approaches. A low-dose combination of 2 drugs is almost always better than just a higher dose of a single drug. Why is that? Because you actually get more powerful blood pressure lowering, but with fewer side effects. Think about it. Each drug works differently, so combining them is like attacking the problem from multiple angles at once. It's just a smarter, more effective, and safer strategy all around. Okay, so all of this leads to a very logical, structured escalation plan that doctors follow. Let's actually walk through what that looks like. This is what's called the stepped care approach. At step 1, you start with one of those first-line drugs. If that's not enough to get to the goal, you move to step 2, a 2-drug combo. Usually something like an ACE inhibitor plus a calcium channel blocker. Still not at goal? Now we're at step 3, where you add a third drug, typically a diuretic. And if that really powerful 3-drug team still doesn't work, we hit step 4. This is a special situation called resistant hypertension. At this point, a doctor will dig a little deeper and add a 4th drug, often one called spironolactone. It's a very systematic process. But that step-by-step plan isn't the whole story. The absolute best treatment is always personalized to the patient, taking their entire health picture into account. And this is where the art of medicine really comes in. Other health conditions a person has heavily influence the drug choice. For instance, if a patient also has diabetes with some kidney issues, an ACE inhibitor or an ARB is a fantastic choice because those drugs also help protect the kidneys. If they have heart failure, a totally different combination might be best. The goal is to pick drugs that can solve 2 problems at once. And yet, even with all of this personalization, the core principle stays incredibly simple. As this quote from a major medical textbook points out, no matter which drug or which combination we choose, the fundamental goal is always the same: a sustained reduction of blood pressure. That is what saves lives. So, what's the big takeaway from all this? I think it's that managing high blood pressure isn't some quick fix. It's really a long-term partnership between you and your healthcare team. There isn't a single magic pill that works for everyone. The real goal is to work with your doctor to find the right combination of medications that gets your blood pressure down safely with the fewest possible side effects. And understanding why certain drugs are chosen and what the step-by-step plan is, well, that's the absolute best first step you can take. It turns a confusing diagnosis into a clear, actionable plan for your own health.